Hi everybody, my name is Claudia and I'll be your host for today. Welcome to episode 4 of Transforming the World Together series. Today we're going to be talking about recovery and what recovery means in terms of mental health. And if we think about recovery, we think about hope, we think about the happiness that it can bring us towards making us feel better, and also it aligns essentially with human rights. So let's delve into what recovery means, and with that said, Charlene Sunkel, if you can come and give us your expertise on recovery.
Yes, recovery is the topic of today. So recovery may sound ridiculous to some people who still seem to believe that someone with a mental health condition, especially serious conditions like schizophrenia and bipolar, is unable to recover. The perceptions of society are sadly still stuck in stigma and misperceptions around these conditions. Well, recovery in the context of mental health, of course, means that there is life after a mental health condition. A mental health condition does not define the person or predict what that person are able to achieve. The recovery approach to mental health is person-centered, so it is not illness-centered. A person-centered or recovery approach basically views the person as a unique individual with a unique set of needs, challenges, ambitions, as well as life goals. And it gives the person the tools to live the best for themselves. An illness-centered approach views the person as a medical problem who needs fixing. So the recovery model is based more on a social model and how the environment impacts on that person's life. The recovery model let the person decide what they need to live a good life for themselves, and it builds on hope, relationships, empowerment, self-determination, personhood, and contributing positively to both the society as well as the economy. No person finds the same elements that would lead to their own recovery. What helped in my recovery is not the same for someone else. So for me, what is most important in my recovery is having a meaningful job, living independently, having good relationships with my sister, for example, and making my own decisions, even if it may seem wrong or inappropriate to others. The fact is, I need to learn from my own mistakes. And also for me, it's important to live a balanced life. And what also helped me in my recovery is to continue to take my medication. So I'm now going to ask Claudia to just tell us a bit more about the important factors that she experienced in her own recovery.
What was really helpful in my recovery was trying to think about a way of bringing holistic modalities to recovery. So for me it means starting yoga, practicing meditation, and those are sorts of things that are very difficult to get into at first, but once you do get into it, it's extremely helpful. It really just centers you and gets you motivated. When I was discharged from hospital, one of the main things I decided to do was embark on studying again. And I chose psychology as my course, and it really just gave me so much insight into what my condition is, what it means, and also how to put things into place that would make me feel better. And with that, having a routine for medication was super important, and that's something that I do. I take it like a ritual. Every morning it has to be taken, and then complementing that with the yoga and the meditation like I previously mentioned. What didn't help for me was, so a toxic environment makes it really difficult to feel better and improve the quality of your life. And given that it's at the workplace and you spend 8 hours or more, the workplace seriously needs to have accommodations in place to help a person that's living with a mental health condition, because with that extra support you're able to perform better and you're also able to feel better. So definitely a toxic environment is something that everybody should consider when they're looking at recovery for themselves and recovery for others. So now if we're looking at it from a human rights perspective, I think it's best that we hand over to Charlene and she can tell us a little bit more about how recovery aligns with human rights.
So let's have a look at the key human rights and how that relates to recovery. First of all, equality, equity, and non-discrimination. So how that relates to recovery in specific is nobody is allowed to discriminate against you based on your mental health condition. Equity means, for example, providing the person reasonable accommodations, for example, in the workplace. And equality means that you need to be treated equally to anybody else. Dignity. Dignity is a big thing. Taking someone's dignity or doing something that impacts on someone's dignity really lowers self-esteem, self-confidence, and one should really respect and protect dignity. That's a right that everybody has. Life, the right to life, liberty and security, I think that speaks quite for itself. In terms of liberty, the person must be able to make their own choices and decisions in life and of their own lives. And then protection from abuse, I think that also speaks quite for itself. No one may abuse you, and especially not based on your mental health condition. Justice, everybody's got a right to access justice and on an equal basis than anybody else. Freedom of opinion and expression, that's quite an important one related to recovery, because everybody with a mental health condition must be able to share their experiences, their views and their perspectives and make choices and give input into life events or other things that really impact on their lives. Human development opportunities, that is a right, for example, related to having access to employment or education opportunities, housing opportunities, anything that helps that person to develop further. Health and mental health, that is a big right that you must be able to access adequate standard of health and mental health care services, as you would kind of define it or identify it. And then a few years ago, the United Nations declared that clean water and sanitation is also a human right.
Cool, thank you so much, Charlene. And I just want to go back to what you said about the rights to clean water and sanitation. I think it's such an important aspect to mention, especially during COVID and the pandemic. I think that's something that everybody just needs to keep in mind. But then moving away from that and just having a look at the peer network focuses on recovery in various aspects with via our mental health advocacy route and activities, peer support, leadership, empowerment and human rights.
My family played a very important role in my recovery.
Definitely paying attention to my stress level and making sure that I get enough rest and sleep has been important. Dealing with previous trauma, like all of these experiences that have been rooted in kind of unresolved trauma. So dealing with stuff that happened when I was a kid and with my parents, and that has been a big part of my healing.
I'd say therapy has been very, very helpful. I mean, I've had to switch and now, right now I'm struggling because I don't have a therapist. But therapy really helped.
I'm the kind of person that likes to do things, I can't sit still. Even when I was at my sickest, back when I was in my 20s, in the 1990s, I was going to school at University of Texas at San Antonio. I actually went to UT Austin, you probably heard of that one. And my mom is a big support, and my boyfriend, I can't forget, and my cat.
Also, what I did was, because I was looking out for other people with similar conditions, I started talking to them and I realized that much of what I was facing was not really unique. It is something that a lot of other people face, and it was much easier to communicate with them. They were a lot less judgmental because they were going through the exact same stuff.
The takeaway message is that we need to look at it from a holistic approach, looking at all factors that play a part, looking at social determinants, looking at human rights, in order to achieve recovery successfully and healthy. And if you guys enjoyed this video, please subscribe and like below, and we'll see you guys soon. Bye everybody.